Chapter 9 Revision Overview. This chapter will help you plan for revision in a realistic way and will suggest some techniques that may be helpful for revising knowledge and skills. We have also collected general experiences and tips from medical students and share them here. We end as usual with commonly asked questions. What is revision? At a basic level, revision is a systematic way of reminding yourself of what you have learned in preparation for a written or practical exam. So much has been written in the last decade about the best ways to revise and the most efficient techniques for committing things to memory that choosing a personal path for revision may be confusing with so many choices available. Remember that you are already adept at passing exams because you have successfully gained GCSEs, A levels, and perhaps a degree. As you already know, revision isn't rocket science, but it is a necessary part of your learning repertoire, and like anything else, revision skills can be made more effective. We have mentioned before the importance of revising right from the beginning of the course rather than leaving things to the last minute. This way, you build your knowledge, understanding, and skills gradually and systematically over time, which will increase your confidence level. If you have managed to review and organize your notes, lecture handouts, articles, etc. each week into a logical filing system, then you are already halfway there. You will have been revising as you went along, and now it will simply be a matter of refreshing your understanding and perhaps getting in some practice for any practical exams. An important thought we would like you to hold in your mind whenever you are revising is to imagine that you are the examiner setting a question on this topic. What understanding would you want to test? What question would you ask to test it? Having this overview always present in your mind will help you to see the knowledge and skills you have acquired from an assessment perspective and will help you to visualize the questions and tasks that you may be asked in an exam. What kind of techniques? So, what kind of revision techniques will work for you? Do you learn well from books? Is it better for you to discuss what you learn in a group? Are you a visual learner who enjoys diagrams or graphic representation of things? As with all learning, we are all unique and do things in different ways. But interestingly, research has shown we remember 20% of what we read, we remember 30% of what we hear, we remember 40% of what we see. We remember 50% of what we say, we remember 60% of what we do, we remember 90% of what we read, see, hear, say, and do. So, a mixture of revision methods may be useful. Draw up a plan. It is vital to spend a few hours drawing up a comprehensive revision plan right at the start. Perhaps have one timetable for each week, decide upon the focus for that week, and then break this down for each day, scheduling how long you will spend revising each topic. Remember to factor in time to eat, relax, and have a period of exercise each day to counteract periods of inactivity, a long walk, or a swim. Draw up revision into blocks of 1.5 hours with 30-minute gaps between to stretch your legs and get a drink. So each revision block lasts 2 hours, and you could aim to do 3 or 4 blocks for each full day, or maybe one if it is an evening session. Factor in at least 2 periods each week when you will revise with others in a group. Providing you have made a comprehensive plan that covers the subjects to be revised and you stick to it, you can stop worrying about whether everything will be covered. Table 9.1 A sample revision timetable from a third-year student revising the heart. Their date, Monday the 18th of January, morning, anatomy of heart, afternoon, physiology of heart, evening 5.00, 7.00 gym and supper 7.00, 9.00 draw rough anatomy, create consolidated diagrams, self-testing. Tuesday the 19th of January, morning, heart failure, main presentation, afternoon, heart failure, treatment and management. Evening 5.00, 6.30 supper and walk, 6.30, 8.30 consolidation, self-testing. Wednesday the 20th of January, morning, myocardial infarction, main presentation, afternoon myocardial infarction, treatment and management, evening 6.00, 7.00 supper revising heart failure and myocardial infarction with Chris. Thursday, the 21st of January, morning group revision on whole topic. Afternoon, revised topics identified in group revision. Evening, minus 6.00, 8.00 supper and gym prepare for practical session tomorrow. Friday, the 22nd of January, morning group work practicing history of chest pain, examining the chest, feedback. Afternoon, reflect on group practice, identify gaps and weaknesses. Evening, epidemiology of heart disease. Saturday, the 23rd of January, morning day off, afternoon day off, evening day off. Sunday, the 24th of January, morning lie-in, afternoon consolidate all topics from this week. Fine-tune finishing touches to notes. Put away files and books not needed any longer. Evening, plan for next week's revision. Read out notes, appropriate books, etc. 3 student commentaries on revision. I like to review all my notes and handouts at the end of each week and file them into module files. I then revise one module at a time in the weeks before an exam. It takes me about 4 weeks to cover each module. I don't write out special revision notes as this would be duplicating the work. I make every set of notes work for me, so it's worth getting them right from the start. I prefer revising on my own, but sometimes get together with others to practice clinical skills. I like working with other people when I don't understand something. I also like reading a wide range of textbooks to make sure I got my head around everything. I revise about 5 nights a week before exams, but keep weekends free for other things. Rachel, second year graduate student. We set up a learning objectives revision group where we look at the learning objectives for all our PBLs and clinical placements and then make sure we have covered everything. That way there are no surprises in exams. Our revision group works like a PBL group. All of us decide which aspects of a subject to find out about and we share in a group our findings. We have a scribe who records everything, but I make my own notes and diagrams, which I condense into a final revision summary. I tend to start revising 8 weeks before an exam and don't do much else. I revise on most days and tend to put my life on hold. Chris, third year student. Because I have 2 young children, it's difficult to get a routine going for revision. I try to keep my notes in order so that the course doesn't get out of control, and everything is kept in a filing cabinet out of the way of the children. I often get up at 5 a.m. to work as I am good in the mornings. My husband has the children all day on Saturday, so I have a good stretch of time to revise in. I always go to the library though as it's quiet. I find that I can revise in a really focused way in quite small amounts of time, and I tend to do this throughout the day. I think having the children has taught me not to waste a minute. Leap, first year graduate student. Organize your space. We talk in chapter 8 about organizing your desk or learning space. For the purposes of revision, however, we recommend a more radical reorganization of your life. The reason for this is to minimize all distractions so that you can really concentrate on revising. So, before getting down to the work, some preparation is necessary. Clean your flat or room, sort out and put things away, change the bed, organize your desk, stock up on healthy food and snacks, do the laundry, tell everyone you are about to start revising, make a do not disturb notice for your door. Think about known distractors. Are there some things that always tend to distract you? Perhaps telephone calls, instant messaging on your computer, or switching the TV on for a second when you have a break only to find yourself sat in front of it 2 hours later. Plan how to avoid these. Perhaps switch off your phone, unplug from the internet, put a towel over the TV. If you live in a place where it is not possible to study in a quiet environment without interruption, then you will need to revise in the library or other room at college. Tutors will be able to help you organize this. During A levels, I was always able to revise everything really quickly just before exams, but this didn't work for me at med school. I had to retake my second year because I failed exams on two occasions and had to learn a different way of studying for deep understanding. I think I was a late starter. Joel, fourth year student, revising knowledge. An important thing for you to know is that just copying out notes from a book or handout will not help you understand or remember them. You need to interpret them and put them into your own words, perhaps by paraphrasing them or converting them into a mind map or flow chart. This is the difference between note-taking or recording the factual content of, say, a lecture and note-making which includes your analysis and interpretation of the information. Exams in the main test your understanding of a topic, not your ability to just memorize it, although there may be a small amount of information that you will need to just remember. After paraphrasing your notes, turn them over and see what you can remember and write out again. You will now understand how useful the advice in Chapter 2 is. If you use Cornell notes or some of the other techniques that we discussed, such as writing questions as you go along, this process will be much easier for you. Try revisiting your notes again in a week's time to see how much you have retained. Perhaps record your notes and try listening to them as you walk around. Pretend you are giving a lecture about this topic. What would you say and how would you organize it? You probably already use revision cards, post-it notes, colored highlighter pens, and mnemonics such as sight, onset, character, radiation. Associated symptoms, timing, exacerbating and relieving factors, severity, a useful basic mnemonic when asking a patient about pain. All of these are helpful tools. I made a batch of revision cards which I carried about with me and looked at when I had slack time, like on the train. I find it easier to revise in short bursts rather than a long session. Alice, first year student. It is often said that the best way to learn something is to teach it, and you may like to do this in a learning group with everyone taking turns of teaching a topic. This works on two levels. First, it shares some of the work of the revision, but it also allows you to test your level of understanding of a topic against your peers. Are you more or less on a level with the others, or are you revising a topic in too great a depth? Are you revising a good breadth or overview of a topic, but not understanding enough of the detail? Learning with others will give you a good gauge of breadth and depth. You may like to look at past papers to get an idea of what has gone before and how questions are written and presented. Try doing some of these papers and timing yourself. Get familiar with the types of question you may be asked, such as extended matching questions, multiple choice questions, short answer questions, best answer questions. Being familiar with the format of the question will allow you to practice and will boost your performance. A really useful exercise is to get a group of people to sit a past paper together, compare the results and decide upon a model answer for each question. How did others in the group tackle the question style? Chapters 10 and 11 look at common question styles and approaches to managing them in more depth. Revising clinical and communication skills. You may already be familiar with a range of written exam formats from your previous study, but the main way that clinical and communication skills are tested at medical school is in an objective structured clinical examination, a practical exam that may be less familiar. In an OSCE, a large room is divided into a number of stations, each one focused on a different task. Each station may contain a model, image, simulated patient or real patient, and an examiner, and you will be asked to carry out a task in 5-10 minutes before a bell rings and you move on to the next station. The examiner will mark you on a range of items connected with the task. The great thing about OSCEs is that although they can be nerve-wracking, you get a broad range of opinion about your competency. For if there are, say, 17 stations in the OSCE, then 17 examiners assess you. In stark contrast to revising knowledge, clinical and communication skills need to be actively revised in pairs or in a group with feedback. You will probably have already covered the main skills to be revised during your course, but these must be practiced. We suggested earlier that just like any other sort of revision, clinical and communication skills should be practiced informally on a weekly basis with your peers. Although remember that revision cannot replace real experiences, but hopefully that message was clear in chapters 3 and 4. It is also helpful if this revision is integrated. The following exercise suggests about how this can be organized. Exercise: an integrated approach to revising clinical and communication skills. Decide as a learning group on a topic, say asthma. The whole group revises the knowledge base for asthma, makes notes, diagrams, collects articles, etc. One member of the group writes a patient scenario or role play that includes the clinical details of asthma and joins these with relevant psychosocial issues the patient may be experiencing. One person plays the patient and the group take it in turns to interview them about their asthma. Don't forget to give each other feedback on the interview, perhaps dividing it into content and process. Use the checklist of communication skills. The group has also looked at skills books and skills handouts on examining the chest, and together you agree on a gold standard for doing this and draw up a checklist. A group member agrees to have their chest examined and you take it in turns to examine each other using your gold standard checklist and not forgetting to give feedback. Don't forget to have your examiner's hat on. If you were writing an OSCE station about asthma, what items would you test and what would you give marks for? We cover OSCEs in more depth in chapter 11. It was hard to connect all the things we had learned in lectures and PBLs to skills. I tried to learn it all from books because I'm okay at that. But in the end, I realized it was about practicing the skills with real people. Once I started doing that, I got the hang of things. Ryan, second year student. Of course, the very best way to revise clinical and communication skills is with real patients. But you may not have reached that stage of the course yet. And so working in a group with colleagues and any simulation models, equipment your medical school may have is a good substitute. The connection between smell and memory. This connection has been well known for many years, but research is clear. University of Northumbria found that smelling rosemary oil produced a significant enhancement of performance for overall quality of memory in healthy adults. This connection can be put to good use in revision. Try this. Buy an aromatherapy oil burner and some rosemary oil. Burn the oil whenever you are revising, but never at any other time. Just before going into the exam, put a few drops of rosemary oil on a tissue and smell it at regular intervals during the exam. Conversely, the same research found that lavender oil significantly decreased memory and performance. So if you are finding it difficult to switch off after revision and sleep, you could try using lavender on your pillow. General hints and tips. These have been gathered from many people and sources, but particularly from medical students who found them helpful. Make a do not disturb notice for your door. Tell friends and family that you are revising and get their help. Stick your revision timetable on the outside of your door so that people can see what you are doing. Turn off your phone for regular periods when you are revising. Tell people that you are going to do this. Eat and drink regularly. There is a well-known connection between healthy food eaten at regular intervals and learning performance. Eat breakfast and have snacks such as bananas, sesame seeds, tuna fish, dried fruit, avocados, nuts, etc. Drink plenty of water. Exercise every day to combat stress and inactivity. It will help you sleep. Gentle music helps some people revise, and you can even buy specially designed CDs in music shops if you feel so inclined. TV, however, never helps. Turn it off. Cross off each topic you revise from your revision timetable. This is deeply satisfying and charts your progress. Go to bed at a reasonable time and get enough sleep. Revising into the night can be counterproductive. Try visualizing yourself entering the exam feeling calm, happy, and in control. Try to imagine what the room will look like and see yourself during the exam calmly writing or performing a task in an OSC station. Keep this positive image in your head. What if I fail? Most of us fail something in our lives, and miserable as that can feel, failing an exam will probably make you a better doctor. Why? Because you will develop strategies to overcome the failure and pass retake exams, and you will have gained valuable experience and insight into what it feels like to fail, which in turn will develop your empathic skills. Failing an exam is not the end of the world, even if it feels like it at the time. And most medical schools will be able to offer you some help and support in preparing for a retake exam or repeating part of the course. Get as much feedback as you can about why you have failed so that you can identify your strengths and weaknesses and get together with any others who have also failed to develop a plan and form a learning group to prepare for what comes next. Try talking to students in the years above you about their revision techniques and tips. Often they will have developed sophisticated strategies, and there is never any point reinventing the wheel. Conversely, though, no one strategy fits everyone, and you will need to design revision around your own strengths and weaknesses and learning style. Summary: in this section, we have looked at what revision is and what it isn't. We have highlighted the differences between revising knowledge and skills and looked at the connection between smell and memory. We have highlighted the practical implications of drawing up a good revision plan and managing your revision space, and have seen examples of revision strategies from 3 students and some suggestions for integrated revision in a group. View the subject you are revising from an examiner perspective. Exams test understanding and not memory. Revise from the beginning of the course. Make a good revision plan and stick to it. People revise in a variety of effective ways. Spend some time revising in a group. Frequently asked questions. Hugh, I seem to spend hours revising but can't remember anything in the exam. A common problem that may be due to poor revision technique. You may spend hours revising, but is it quality revision? Have you made a timetable, allocated topics to blocks of time, paraphrased your notes, and shared revision with a group? It really is about the quality of the revision and not the quantity. Beginning your revision in good time will also increase your confidence because you will know you have everything covered. Hugh, I seem to panic just before going into an exam. Exams can be very stressful, and most people feel a bit panicky at the start. Remember that this panic will cause a fight or flight reaction. Go through the breathing and relaxation techniques suggested in Chapter 8 and think about a more long-term solution such as yoga. If this becomes a really big problem for you, then you need to seek help from your counseling service who may be able to help you develop individual strategies to combat your panic. Hugh, I lost a load of my revision notes on the bus. This bad luck can be turned into a really good revision tool. Ask to borrow other people's notes, look at the books to check the content, paraphrase them into something that makes sense to you. Compare revision notes for depth and breadth, present what you have learned in a group. By doing all of this, you are actively revising and may even revise more effectively this way. Hugh, I never know how soon to start revising before an exam. I hope that we have convinced you that revision is something you should be doing as you go along every week, and that the last few weeks before an exam should be a time for fine-tuning and consolidation, as you won't be able to cram a year of learning into 5 weeks. A few weeks before the exam, draw up a revision timetable so that you can review and remind yourself of what you have learned. Leave plenty of time so things are not rushed and there is time to cover things in enough detail.